Welcome to Inclusion Health podcast series.
This is part of a continuum of Including Inclusion Health
Voices from the Margins webinar series.
One of the first things is a basic level of trauma awareness across all staff. So often, actually, it's the first point of contact is the problem sometimes. So you have to have everybody trained to know that if you just smile and look at somebody, that in itself will help reduce somebody's stress, which makes them less likely to kick off.
I think what's been really interesting in the Irish case is obviously we don't have a universal system of access to primary care. So, if you want to go to see the GP and you don't have a medical or a GP visit card, there's significant financial cost associated with that, and that can be a real barrier for certain groups. But I suppose some of our research has highlighted that there's not necessarily only financial barriers, there can be other barriers too.
What we found from our initial stages was that there was a general accepted need to provide education awareness, particularly in relation to pronouns and terminology. Basically providing an on-the-ground forum where we could discuss basic do's and don'ts when it comes to understanding language and having sensitive discussions, particularly when it does come to transgender care. It is a very topical conversation at the moment, and rightly so, because society has changed so much.
Children are describing the lived experience of domestic violence and abuse in their own words. I think as adults we use terms such as coercive control, emotional abuse, we used intimidation. However, children and young people are saying it is shouting, fighting, name-calling, punches, bruises and blood. And I think that brings us really clearly into that day-to-day experience for children at home.
So, what happens if I start talking like this? There's an immediate change in your nervous system, which means, believe it or not, I've just activated your brain system.
What happens doesn't actually need to even be thought about. What's happened there between you and I right now, which isn't pretend, which isn't made up, which isn't me teaching you about a play system, we've actually shared a moment of joy together.